Hi, everyone, and welcome back. My name is Maria Bermudez. I'm a disability lawyer, and today we're going to be talking about mental health impairments and how Social Security views them and assesses them in connection with your claim for disability benefits. So let's get right into it. So there's two main ways that Social Security is going to assess your mental health impairments and decide whether or not you're disabled based on those mental health conditions. So the first thing is, what are you diagnosed with? So before we're even getting into restrictions or limitations, how your conditions impact your ability to work, they need to know what your conditions are. So this is super important for the first way that Social Security decides if you're disabled from a mental health impairment, and that's Social Security's listing of impairments. So there's various different listings, which is criteria, where Social Security will decide if you are disabled based on certain criteria. So if you meet a listing based on your condition and how it impacts you, what you're diagnosed with and how it impacts you, your limitations, and how you're dealing with that diagnosis, then Social Security may find you disabled based on what they call their listing of impairments. So that's the first thing. The second thing is called your residual functional capacity. They frame it when they're talking about it as what you're capable of, but the way that we kind of look at it is like, what are your limitations? If you have difficulty completing tasks, that's a limitation, right? So they look at it the opposite way, which is what are you capable of when they're formulating your residual functional capacity. In both of these situations, whether you meet a listing or whether they're deciding that your work capacity, there's no jobs that you can do based on your work capacity. The center of their analysis when it comes to mental health impairments, there's four things that they're looking at. And that is what we refer to as the B criteria. The first is your ability to understand, remember, and carry out tasks. So when you're thinking about this and you're communicating with Social Security what your limitations are, what your capabilities are, they're going to look at your medical records, of course, and then they have to consider what you say about this as well. But they're going to be looking at an example of your ability to understand, remember, and carry out tasks or apply information would be like, in an everyday term, a recipe, for example. Would you be able to have a short recipe and complete it? What about if you got furniture? Would you be able to look at the directions and figure out how to put furniture together? Those are examples. That's not something we necessarily look at in terms of Social Security, but they're looking at very basic things. Your ability to make your own doctor's appointments. Furniture might be hard. I even have a hard time figuring out directions for furniture sometimes, but that's the overall essence of that first criteria. Understand, remember, and apply information. The second thing is social functioning. So they're going to be looking at whether you can get along with people. I had a client, this is many years ago, who every time she had to communicate with someone, she was always crying. And this went on for years and years. It wasn't like just a short period of time. No matter how much therapy, no matter how much medication, she was crying all the time. Every doctor's appointment, every interaction, everywhere she went, whoever she talked to, she was always crying. Or sometimes people are just very antagonistic. They don't get along with people. So those are things that they're looking at because the ability to function socially is something that's very relevant, obviously, to your work capacity. The third thing is what they call concentration, persistence, and pace. So you can imagine why this is important from a disability perspective, because you have to be able to concentrate on what you're doing in order to get your job done or the tasks that you're assigned to do in a work setting. So concentration, persistence, continuing to do whatever it is that you're supposed to be doing, and keeping pace. Even easy jobs are going to have requirements of the job. I did this before, worked in an Italian food factory. It was like a production center. We had to make sure that the raviolis were in the bag properly and there was coming out of the machine and everything was tied. So like keeping pace, making sure that you are, doing things in accordance with whatever your job is, even if it's an easy job. The fourth area they're looking at is adaptation. So adaptation is your ability to take care of yourself and adapt to your environment, changes in your environment. So for example, if your supervisor comes to you and they're like, hey, we're going to have to do this today instead of this, which you normally do. If you have a breakdown, then that's a restriction or a limitation in adaptation. So your ability to handle some changes, even if they're easy, and your ability to take care of yourself, you have to be able to get to work, right? So being able to get up on time, being able to groom yourself without prompting or needing help. Those are things that they're looking at in this adaptation. So those are the four main areas that Social Security is going to look at, whether you don't meet a listing and they then have to go on to, step 3.5 is what they call it, which is developing your residual functional capacity. In either event, no matter what, Social Security is going to be looking at your ability to perform in these four areas: understanding, remembering, and applying information, social functioning, concentration, persistence, and pace, and adaptation. The second part of it is how do you prove these things? So you have the diagnosis, you believe you have limitations, you clearly do, your family, or friends or whoever's in your environment agrees that you have limitations in these four areas or one of these areas or two of these areas. So then how do you prove that you have significant limitations in these areas? Social Security is going to look at whether you have mild limitations, moderate limitations, marked limitations, extreme limitations in these areas. Those are the four ways they're going to look at it. How does that translate into disability? When you're talking about the listings, you need to have 2 marked or 1 extreme in these areas, right? So if you have marked limitations in your ability to function socially, and you have marked limitations in your ability to understand, remember, and carry out and apply information, then you will be found disabled. You will be found to have met a listing. It doesn't translate that way specifically for the residual functional capacity. There's other ways that they look at your restrictions and limitations. So it's not that clear cut, but in any event, you have to prove that you have significant limitations in these 4 areas in order to be found disabled. So how do you prove that? Back in the day, you used to be able to prove significant limitations solely by having inpatient hospitalizations. I'll still get prospective clients sometimes who will call me and be like, oh, well, I should definitely be found disabled because I was hospitalized twice and it was for at least a week each or 3 times. Over about 10 years ago, that used to be the case. That was clear cut. If you were hospitalized, you would be found to be disabled. But that's not the case anymore. They're looking at these 4 areas again. So how do you prove it? Hospitalization can be one of the ways. Level of treatment can certainly be an indication of severity, right? Your ability to take care of yourself if you're being hospitalized or you have been hospitalized, that's obviously an indication of the severity of your mental health limitations. Another thing they look at is what we call mental status exam findings. So when you go to the doctor, whether it's physical or mental, a lot of people don't realize this, but they're observing you and they're jotting down what they call abnormalities. So if you're doing like ticking sensation, your motor function, or if you are, you can't maintain eye contact or you don't, or if you're crying, if you can't focus on the conversation, you're all over the place. These are different things that they are documenting in your medical records, and that is evidence. Those are what we call objective abnormalities. They're not things that you even are conscious that your doctor is documenting a lot of times, but they are, and that's evidence of impairment, and that's evidence of severity. On the contrary, if you go to the doctor and you're bubbly, or you're super normal, or you're on top of things, you know everything, you articulate yourself super well, and you have a great demeanor, you're getting along wonderfully, they're also documenting that too. So a lot of times we'll see in mental health cases appear sad. Sometimes people are crying, that sort of thing, but they can also tell the difference and they assess for malingering. So don't take this as a suggestion to appear any type of way, a different type of way to your doctors. Obviously, be yourself, let them know what's going on with you. And that goes into another thing that they're looking at, and that's subjective reports. So if you're explaining to your doctors, everything you say to your doctors should be documented. And so if you're saying, listen, doctor, I'm having panic attacks, or, I get overwhelmed easy, or, I'm having a hard time getting through the day, like I don't brush my teeth until whatever time, or sometimes I forget, or I'm not showering, things like that, and they're documenting it, your subjective reports, that is considered evidence as well. What medications you're taking. How effective are they? Is it an antipsychotic? Is it an antidepressant? Is it a mood stabilizer? Is it a benzo? So what kinds of medication? If you're in therapy, what kinds of therapy? There's a lot of different kinds of therapy. Are you in talk therapy? Are you in trauma therapy, like say EMDR? Are you in DBT, CBT? Like there's a lot of different therapies as well. So, and then have you tried different things and they were not successful? So there is a range of different things that they're looking at when it comes to mental health impairments. It's not enough to simply say, I'm depressed, I lack motivation, I'm emotional, I can't, get out of the house, I don't feel good, I'm not getting along with people. There's the second prong to that is, and this is with physical or mental, well, what have you done to treat this or to, help your condition, and do you continue to have these symptoms and limitations despite that? And that goes for physical and mental. Treatment is a huge part of the analysis. That is the gist. It's obviously very nuanced and there's a lot more to it, but that's just an overall kind of summary of how I look at Social Security's evaluation of mental health impairments. Now, I will tell you, most of the time, in my experience, having done this for 16 years, we're not seeing a ton of cases where it's like mental health only and they're getting awarded benefits. That doesn't happen a lot, especially now. Maybe back in the day, especially before the listings changed 10 years ago. But at this point right now, when I get a prospect that calls me and says, I'm depressed, I'm anxious, okay, well, what's your treatment? Well, I'm in therapy once a week, once every 2 weeks, once a month. I see my psychiatrist virtually once a month, once every 2 months, once every 3 months. That is not generally going to be a case that I'm going to take, right? That's what they call conservative treatment. People work full-time jobs and still go to therapy and are on an antidepressant. So that's not typically a case that I would take. Many of my colleagues feel the same way. There are cases that are mental health only that we certainly will take that, do get awarded. But what we see, my message here is what we see here most of the time when it comes to mental health impairments is not that someone is simply having, their claim is based simply on mental health. What we see almost, every claim is that mental health is a contributing factor to overall disability. Not everyone knows this, but Social Security looks at a whole body approach. Even if you had an injury, that's the reason why you're claiming disability, right? So you can't walk even after surgery. So if that's the case, Social Security is not just going to consider that injury. They're going to consider everything else in your ability to perform work activities. So they're going to be looking, do you have a vision impairment that affects your ability to work? Do you have hearing loss? Do you have a mental health impairment? Do you have, carpal tunnel that maybe didn't totally preclude you from working before, but now it's a factor. So Social Security takes a whole body approach. So when we're looking at mental health impairments, we're not simply looking at it like, oh, that's a mental health only case. That person has depression. They can't work because of their depression. There are cases where that might be the case, but we're also, in the majority of cases, looking at how does mental health impact the overall functioning. I hope that makes sense to you. So I hope you found this information helpful. And my name is Maria Bermudez, attorney with Disability Advocacy Group, and I'll see you on the next one.